Now, if you look at incidence per se, there are more than 35,000 new liver cancer cases which are diagnosed every year in India. Liver is predominantly made up of hepatocytes and biliary ducts. Hepatocytes, which are normal cells, when they turn abnormal and start multiplying abnormally without any control, they form cancer cells. So this type of cancer is called hepatocellular carcinoma. And this is the most common form of liver cancer, which is seen worldwide as well as in India. Liver cancer is the 11th most common type of cancer seen in India. If you look at the incidence of liver cancer, it was initially seen more commonly in north and eastern states, but slowly it has also been an increasing trend in the western states like Goa, Gujarat, or even southern states like Kerala. Now, if you look at incidence per se, there are more than 35,000 new liver cancer cases which are diagnosed every year in India, and more than 38,000 patients are dying of liver cancer every year in India. And this trend is continuing to rise. Coming to the risk factors of liver cancer, one of the common among them is hepatitis B virus infection. And then there is another virus which can cause liver cancer, that is HCV, hepatitis C virus. Now, these viruses can be transmitted through either sexual contact or blood product contaminated, which is transfused, and using needles which are contaminated, and in cases like hepatitis B, they can also transfuse from mother to the child. But the good news is hepatitis B has a vaccine, and vaccination is usually given at birth, and it is part of our national guidelines as well. Now, apart from virus infection, what else can cause liver cancer is your unhealthy diet practices which lead to obesity and also diabetes, which can cause fat accumulation in the liver, leads to a condition called NASH, which is non-alcoholic steatohepatitis. Now, this condition also, though you do not have alcohol intake history, can lead to a cancer because of this fatty accumulation in the liver for long periods of time. Then comes a very well-known risk factor, that is your alcohol intake, because no amount of alcohol is safe. Even reduced quantity of alcohol consumed for a longer duration of times can lead to liver cancer. And then there's a toxin called aflatoxin, which is a poison produced by fungus. And this is usually seen in nuts which are not stored properly, especially if these nuts are stored in hot and humid conditions. Then there's a chance of this fungus growing and producing this aflatoxin. And when these nuts are ingested, these poison substances can lead to liver injury and finally leading to liver cancer. Then finally, the most well-known cause, what we all know, is cirrhosis. Now, this cirrhosis can happen because of a multitude of conditions. It can be an alcohol-induced cirrhosis, it can be hepatitis B or C virus-induced cirrhosis, or it can also be a non-alcoholic steatohepatitis-induced cirrhosis. So, whatever may be the reason, if the patient develops cirrhosis, then he is definitely at a higher risk of developing liver cancer, and he has to be at a constant surveillance. So, coming to the signs and symptoms of liver cancer, the problem is early signs are often not very specific for liver cancer. So most of the time these early signs are ignored, and then later on you get the signs and symptoms of an advanced stage liver cancer. So to begin with, what early signs could be, what are the early hints of liver cancer is, you may have a small discomfort in your abdomen, right-sided shoulder neck blade pain, and also loss of appetite, loss of energy, feeling weakness most of the time, and losing weight without any reason, without any diet or exercise. And then once the disease has started to get into more advanced stage, you may have symptoms like jaundice, or even fullness in the abdomen and swelling in the abdomen, easily getting bruised, easily getting bleeding episodes. Such kind of symptoms can be seen. Early detection is very important in liver cancer because it will change the prognosis of the disease very markedly. One thing, early detection helps in less intensive treatments which have lesser side effects, and the efficacy of treatment also is very high. The later the diagnosis, more number of treatments, lesser chance of getting cured, and more chances of side effects. That is why detecting HCC, liver cancer, early is very, very important. Now, what are the common diagnostic tests which are used for diagnosing this condition is, you start off with a basic ultrasound scan, and if you find any abnormal nodules seen in the liver, then you follow it up with either a CT scan and MRI, and in some cases you will also need a biopsy from those abnormal nodules to determine what type of liver cancer it can be. Purely looking at survival chances in terms of early detection, if you're detecting a cancer at a very early stage or an early stage, your 5-year survival chances are more than 70%. The same thing, as the stage keeps increasing, if it's an advanced stage, the survival chances may fall to only 2.5 years. And if it's in very advanced stage, terminal stage, the chance of surviving a liver cancer is even less than a year. So that is how significant it is. A chance of cure to a survival of less than 1 year. That is why your early detection is very, very important. The available treatment option for liver cancer depends on what stage is the liver cancer. If it is in a very early stage or early stage, the treatment modality mainly consists of either surgical resection or a radiofrequency ablation or a microwave ablation. And if it's in a bit of intermediate stage, then multiple treatment options like TACE, which is trans-arterial chemoembolization, or TARE, and TACE along with a targeted therapy. And if there is a cirrhosis background and the liver functions are not doing good, then even transplantation is a treatment option. And then once the tumor has spread beyond the liver, or if the patient's performance status is poor, in such kind of scenarios, the main treatment modality will be systemic therapies. Now, systemic therapies means it includes your immunotherapies, your targeted therapies, your tyrosine kinase inhibitors tablets, and so on. In order to reduce your risk of liver cancer, you can follow these small and important tips. One, reduce your alcohol content, and whenever possible, completely avoid it, because no amount of alcohol is safe. Then, if you're already having an hepatitis B or C infections, then get it treated and make sure that the viral load is within normal range, so that with the treatment of hepatitis B, your risk further reduces. Though you have a hepatitis B infection, if you're getting it treated, the risk of liver cancer further reduces. And then if you already have diabetes, then continue monitoring the diabetes, be on a very good diet and control the diabetes well, because by having diabetes under control and comparing it with the person whose diabetes is not under control, when diabetes is not under control, the chance of getting liver cancer increases. So even if you're diabetic, not to worry, just make sure that your diabetes is under control. Then having a balanced diet, and with this balanced diet, help not getting into obesity zone, having a balanced weight at the same time. Both of them help in reducing your fatty liver changes and then ultimately reducing the risk of liver cancer. Then also, when you're consuming these dry fruits, especially nuts, just be sure that the storage practices have been very good and they are from standard places, because any malpractices in the storage can result in fungal infections, and these fungus infections, if they're producing aflatoxin, that again increase your risk of liver cancer. To summarize, avoid alcohol. If you're hepatitis B, get it treated. Diabetes under control, having a balanced diet and a good weight control measures, and eating dry fruits from good storage area will help reducing your chances of liver cancer. Everybody will be needing a screening for liver cancer, but there are certain people who are at a higher risk of getting liver cancer compared to the normal population. So these are the individuals who will benefit by undergoing routine surveillance for liver cancer. So who are these people? One, a patient who has developed cirrhosis of his liver, then a patient who has hepatitis B or hepatitis C infections, and fourth, patient who has non-alcoholic steatohepatitis. So if they have any of these four conditions, because they are at a higher risk of developing liver cancer, they should be in a constant surveillance. And this surveillance is commonly done once in every 6 months with an ultrasound abdomen. If you find anything abnormal in the ultrasound abdomen, then further tests are done. But every 6 months, they should undergo surveillance with an ultrasound scan of the abdomen. To simplify it, get HPV vaccination done, avoid alcohol, maintain a healthy weight, and if you're falling into the high risk category, follow the surveillance schedules very strictly, because early detection can save lives. If you have any more queries about liver cancer, please comment in the comment section and stay tuned for more oncology related updates.